I've never asked a patient, are you a Democrat or Republican? I've never asked a patient, are you, Jewish, Muslim, or Christian? If I'm going to be there to serve you, I certainly need to come back and hear your feedback. It's no different than being a physician, right? If I give a medication to a patient, do I then leave the room and never come back? No, of course I don't. I come back and you say, how are you feeling? Is it working? My nephew, he had leukemia, and there was a boy in a room a couple doors down, and the father could hardly ever come and sit with his child when he was getting chemo, when he was sick, when he was dying, because he had to work a second job, a third job, to be able to pay for his care. I mean, that's not the system we want to live in. When our family members are ill, we don't want to worry about a bill. We want to worry about, can I hold your hand? How are you feeling? Is the medicine working? Are you comfortable?
What we are doing is we want to terminate health care under Obamacare because it's bad, and we're replacing it with a great health care at far less money, and it includes pre-existing conditions.
Healthcare was the biggest thing that pushed me in at that point, because I was afraid we were going to go backwards on it. We were going to lose. We had 20 million people have access to health insurance because of the ACA. And the chance that all those people would then lose it, that's heartbreaking. That's beyond devastating. And they talked about repeal and replace over and over, and we know they had no replace, they just had repeal. So that is why I knew I could impact that more at a federal level. I come from a background of medicine. I don't come from a world of politics. And my work has always been about somebody coming to me at a time of crisis, listening to them, hearing what their issues are, and then trying to work on a team of folks together to come up with a solution and then implement it. And it's never been about any kind of partisanship, right? I've never asked a patient, are you a Democrat or Republican? I've never asked a patient, are you, Jewish, Muslim, or Christian? I've said, what is your problem today? What is hurting you, and how can I help? And that's what I believe legislators should be doing. They should be saying, what are the problems in our communities, and how can I make it better? Where can I pass some legislation and intervene on your behalf to make your life better, your children's lives better, your family's lives better? It's been about, coming up with a real solution for this problem of healthcare, for the crisis that our public education system has, and higher education affordability, for making sure we protect retirement security. All these things need solutions. They don't need ideology, they don't need partisanship. And frankly, what I have found is that we have a lot more in common than what separates us. And we may not always agree, but what we will do is we will have an honest dialogue, and we will talk about how we can truly get to those solutions. I don't think that that's radical thinking. I think that's actually very pragmatic. That's how you solve problems.